A 44-year-old woman presents with right wrist pain. She fell on her hand the previous day and has pain in her radial wrist. The wrist is tender in the anatomic snuff box. Plain radiographs of the wrist are completely normal. Which of the following is the most appropriate next step in management? Options are A. Orthopedics consultation, B. Discharge home with thumb range of motion exercises, C. Discharge home with Velcro wrist splint, D. Discharge home with thumb spiker splint, E. Admit for observation of wrist. Pause and answer. Answer D. Discharge home with thumb spiker splint. Patients with fall on outstretched hand, FOOSH, injuries may have bony or ligamentous damage in any part of their upper extremity. The bones of the wrist are most susceptible to injury. The anatomic snuff box is demarcated by the extensor pollicis brevis and longus tendons just proximal to the thumb, and tenderness in this region indicates possible fracture to the scaphoid. Scaphoid fracture is particularly dangerous because of the high rate of AVN and resulting limitation of thumb function. Almost 1/5 of all scaphoid fractures are invisible on acute radiographs, so appropriate management in suspected cases includes immobilization in a thumb spiker cast and repeat radiographs in 1 to 2 weeks. There is no need for emergent orthopedic consultation in patients with negative X-rays. Discharging the patient home without a splint that immobilize the thumb is contraindicated. Admission for observation is not an appropriate use of resources.